Hi, I'm Michael Palmer with 45 Urgent Care. I'm here with your tip of the week. Today I'd like to talk to you guys about urinary tract infections and some of the complications that can arise from urinary tract infections. Now, urinary tract infections can present with a lot of different symptoms. Most people experience pain or burning with urination, maybe a foul odor in the urine. But some people are not even having these symptoms. It could be something as simple as just lower abdominal pain, nausea, vomiting, and fever. Now, the big thing, the big point I wanted to get across with urinary tract infections that a lot of people don't think about is some of the complications that can arise from this if left untreated. Now, urinary tract infections will force sufferers to experience frequency of urination. Now, urinating a lot can also lead to dehydration, as well as if you're running into nausea and vomiting that's going along with it, leading and progressing you into symptoms of dehydration. Now, also left untreated, urinary tract infections can even lead to urinary sepsis, which is actually developing an infection in your bloodstream that requires hospitalization and IV antibiotics. Now, on the general variety of urinary tract infections that most people present with can be alleviated with in the clinic by running a urinalysis, which we look for specific findings in your urine to determine if you're having an infection. If you're found to have an infection, the provider will put you on antibiotics that tend to be sensitive to the organisms, and as well as other medications to help with the discomfort that comes along with it. Now, if we see patients that are having ongoing urinary tract infections that are not responding to the antibiotics, we will send their urine out for actually testing. In the laboratories, we're able to actually culture urine and actually try different antibiotics on the different organisms that have been identified in the laboratories and to see which ones they're most sensitive to. Now, another complication that can arise from us leaving urinary tract infections untreated is these can spread up through the urinary system and actually into the kidneys, developing a condition called what's called pyelonephritis. Now, this is getting into a little more serious condition that the infection has now spread into the kidneys and is creating serious problems. Now, in those situations, those problems can sometimes be treated outpatient with antibiotics, but sometimes requiring hospitalizations for IV antibiotics. Now, I suggest anyone that's having symptoms of nausea, vomiting, fever, especially lower abdominal pain, needs to be evaluated by your healthcare provider. Like I said, especially when we're having these vague symptoms, I always think it's a good idea for healthcare providers to get a urinalysis, because not only we're checking the urine for any signs of infection, but also in those cases and with those symptoms for pregnancy that's been undiagnosed. Now,